Welcome to my channel. Get ready to know about the Discover These Prevent Treatment High Blood Pressure in age 40 and above. And don't forget to subscribe and hit the bell icon so you never miss out on our latest uploads. Now, without further ado, let's dive into today's video. Preventing and managing high blood pressure, hypertension, is crucial, especially as individuals age. Here are some effective strategies to prevent and treat high blood pressure in individuals aged 40 and above. Healthy diet. Encourage a diet rich in fruits, vegetables, whole grains, and lean proteins. Emphasize foods low in saturated fats, cholesterol, and sodium. Dietary approaches to stop hypertension. Diet is particularly beneficial for reducing blood pressure. Regular exercise. Encourage regular physical activity, aiming for at least 150 minutes of moderate intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week. Activities like walking, swimming, cycling, and strength training can help lower blood pressure. Maintain a healthy weight. Excess weight, especially around the waist, can increase the risk of high blood pressure. Encourage weight loss through a combination of diet and exercise. Limit alcohol consumption. Excessive alcohol intake can raise blood pressure. Advise moderation in alcohol consumption, limiting it to no more than 1 drink per day for women and 2 drinks per day for men. Quit smoking. Smoking damages blood vessels and can elevate blood pressure. Encourage smoking cessation through support groups, counseling, or nicotine replacement therapy. Reduce stress. Chronic stress can contribute to high blood pressure. Encourage stress-reducing activities such as meditation, deep breathing exercises, yoga, or hobbies. Limit sodium intake. Excessive sodium consumption can raise blood pressure. Advise limiting sodium intake to less than 2,300 milligrams per day, or even lower if possible. Monitor blood pressure regularly. Regular monitoring allows for early detection of high blood pressure. Encourage individuals to check their blood pressure at home and to schedule regular checkups with their healthcare provider. Medication compliance. If prescribed medication for hypertension, it's important to take it as directed by a healthcare professional. Skipping doses or stopping medication abruptly can lead to uncontrolled blood pressure. Manage chronic conditions. Conditions such as diabetes and high cholesterol can contribute to high blood pressure. Encourage individuals to manage these conditions effectively through medication, lifestyle changes, and regular monitoring. Sleep well. Poor sleep habits, such as sleep deprivation or sleep apnea, can elevate blood pressure. Encourage good sleep hygiene, including consistent sleep schedules and creating a comfortable sleep environment. Limit caffeine. Excessive caffeine intake can temporarily raise blood pressure. Advise moderation in caffeine consumption, especially for those who are sensitive to its effects. Hypertension, high blood pressure, is when the pressure in your blood vessels is too high, 140/90 mmHg or higher. It is common but can be serious if not treated. People with high blood pressure may not feel symptoms. The only way to know is to get your blood pressure checked. Things that increase the risk of having high blood pressure include older age, genetics, being overweight or obese, not being physically active, high salt diet, drinking too much alcohol. Lifestyle changes like eating a healthier diet, quitting tobacco, and being more active can help lower blood pressure. Some people may still need to take medicines. Blood pressure is written as 2 numbers. The first, systolic, number represents the pressure in blood vessels when the heart contracts or beats. The second, diastolic, number represents the pressure in the vessels when the heart rests between beats. Hypertension is diagnosed if, when it is measured on 2 different days, the systolic blood pressure readings on both days is greater than or equal to 140 millimeters of mercury, and or the diastolic blood pressure readings on both days is greater than or equal to 90 millimeters of mercury. Risk factors. Modifiable risk factors include unhealthy diets, excessive salt consumption, a diet high in saturated fat and trans fats, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. Non-modifiable risk factors include a family history of hypertension, age over 65 years, and county existing diseases such as diabetes or kidney disease. Symptoms. Most people with hypertension don't feel any symptoms. Very high blood pressures can cause headaches, blurred vision, chest pain, and other symptoms. Checking your blood pressure is the best way to know if you have high blood pressure. If hypertension isn't treated, it can cause other health conditions like kidney disease, heart disease, and stroke. People with very high blood pressure, usually 180/120 or higher, can experience symptoms including severe headaches, chest pain, dizziness, difficulty breathing, nausea, vomiting, blurred vision or other vision changes, anxiety, confusion, buzzing in the ears, nosebleeds, abnormal heart rhythm. If you are experiencing any of these symptoms and a high blood pressure, seek care immediately. The only way to detect hypertension is to have a health professional measure blood pressure. Having blood pressure measured is quick and painless, although individuals can measure their own blood pressure using automated devices. An evaluation by a health professional is important for assessment of risk and associated conditions. Treatment. Lifestyle changes can help lower high blood pressure. These include eating a healthy, low-salt diet, losing weight, being physically active, quitting tobacco. If you have high blood pressure, your doctor may recommend one or more medicines. Your recommended blood pressure goal may depend on what other health conditions you have. Blood pressure goal is less than 130/80 if you have cardiovascular disease, heart disease or stroke, diabetes, high blood sugar, chronic kidney disease, high risk for cardiovascular disease. For most people, the goal is to have a blood pressure less than 140/90. There are several common blood pressure medicines. ACE inhibitors including enalapril and lisinopril relax blood vessels and prevent kidney damage. Angiotensin II receptor blockers, ARBs, including losartan and telmisartan relax blood vessels and prevent kidney damage. Calcium channel blockers including amlodipine and felodipine relax blood vessels. Diuretics including hydrochlorothiazide and chlorthalidone eliminate extra water from the body, lowering blood pressure. Prevention. Lifestyle changes can help lower high blood pressure and can help anyone with hypertension. Many who make these changes will still need to take medicine. These lifestyle changes can help prevent and lower high blood pressure. Eat more vegetables and fruits. Sit less. Be more physically active, which can include walking, running, swimming, dancing, or activities that build strength, like lifting weights. Get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity. Do strength building exercises 2 or more days each week. Lose weight if you're overweight or obese. Take medicines as prescribed by your healthcare professional. Keep appointments with your healthcare professional. Don't eat too much salty food. Try to stay under 2 grams per day. Eat foods high in saturated or trans fats. Smoke or use tobacco.
Drink too much alcohol. 1 drink daily max for women, 2 for men. Miss or share medication. Reducing hypertension prevents heart attack, stroke, and kidney damage, as well as other health problems. Reduce the risks of hypertension by reducing and managing stress, regularly checking blood pressure, treating high blood pressure, managing other medical conditions, complications of uncontrolled hypertension. Among other complications, hypertension can cause serious damage to the heart. Excessive pressure can harden arteries, decreasing the flow of blood and oxygen to the heart. This elevated pressure and reduced blood flow can cause chest pain, also called angina, heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cells die from lack of oxygen. The longer the blood flow is blocked, the greater the damage to the heart. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital body organs, and irregular heartbeat, which can lead to a sudden death. Hypertension can also burst or block arteries that supply blood and oxygen to the brain, causing a stroke. In addition, hypertension can cause kidney damage, leading to kidney failure. Hypertension in low and middle-income countries. The prevalence of hypertension varies across regions and country income groups. The WHO African region has the highest prevalence of hypertension, 27%, while the WHO region of the Americas has the lowest prevalence of hypertension, 18%. The number of adults with hypertension increased from 594 million in 1975 to 113 billion in 2015, with the increase seen largely in low and middle-income countries. This increase is due mainly to a rise in hypertension risk factors in those populations. WHO response? The World Health Organization, WHO, supports countries to reduce hypertension as a public health problem. In 2021, WHO released a new guideline on the pharmacological treatment of hypertension in adults. The publication provides evidence-based recommendations for the initiation of treatment of hypertension and recommended intervals for follow-up. The document also includes target blood pressure to be achieved for control and information on who, in the healthcare system, can initiate treatment. To support governments in strengthening the prevention and control of cardiovascular disease, WHO and the United States Centers for Disease Control and Prevention launched the Global Hearts Initiative in September 2016, which includes the Hearts Technical Package. The 6 modules of the Hearts Technical Package: healthy lifestyle counseling, evidence-based treatment protocols, access to essential medicines and technology, risk-based management, team-based care, and systems for monitoring, provide a strategic approach to improve cardiovascular health in countries across the world. By implementing these strategies, individuals aged 40 and above can effectively prevent and manage high blood pressure, reducing their risk of associated complications such as heart disease, stroke, and kidney disease. However, it's important for individuals to consult with their healthcare provider before making any significant changes to their lifestyle or medication regimen. Thank you so much for watching. If you enjoyed this video, don't forget to give it a thumbs up and leave a comment below. And if you haven't already, make sure to check out these other awesome videos from our channel. You might find something you love. Remember to subscribe and hit the bell icon so you never miss out on our latest content. Thanks for watching.